There we go. So good afternoon, everybody. Good afternoon, colleagues. Engagements, specifically within the CEU that we have incorporated into 5 the aspect of about our learning and teaching or our research. The important aspect is that we will be facilitating that our activities should be impacting society. Our vision, our mission, we are also aiming at transforming and sustaining the health of communities through leadership in innovative, collaborative, interprofessional practices. And so when we look at community engagement, it has been mentioned a few times in terms of how we frame community engagement. And so within the CHS faculty, also conceptualize our activities related to community engagement within the Boyers model. And specifically, we look at the scholarship of application or the scholarship of engagement. The center of that is around looking at what the community needs are and how these community needs can actually inform our curricular or our curricular activities. With regards to the scholarship of integration, we also look at the collaboration and the relationships between the communities within which our students work, and how these communities or organizations, how we are able to, through our community engagement activities, address the health and social needs of communities. And so just briefly, the types of community engagement within CHS, it has also been highlighted this afternoon. We talk about community-based education or integrating learning. We have departments that have clinical, the focus is on professional practice. And then we also professions or our departments or programs, aspects of service learning in the faculty as rich as well. And then we tend to do this specifically at a collaborative way. So we focus on the aspects of collaborative practice. And so what we've done, within engagement more within the Faculty of Community and Health Sciences, we have our interprofessional education unit, not community engagement unit. We have 3 specific communities that we focus on, and it is in these communities that we do our collaborative practice. This includes the Santa Cruz and Bellville. We do specifically, as I mentioned previously, we also have collaborative community outreach programs, and these are often thematic. And one of the thematic areas that we focused on in 2021, one was around caring for the carer. It's also interesting to note and very positive that in this community outreach program, we partnered with the faculties of law as well as science and dentistry. And so it was basically, beyond CHS that we were able to move out. And I think it's important for us to note that community needs are holistic and are broader than health, although health in our, thinking and definition encompasses more than the absence of or the presence of disease. But in terms of holistic approach, does definitely indicate, how more than CHS or the Faculty of Community and Health Sciences is needed in terms of some of our community engagement acts. Also use a thematic approach in some of our community engagement or working together. Some of the themes relates to youth and integrating or educators at schools. Nutrition is an important just in terms of food security, in terms of within the communities as well. Early childhood development is another area that we focus on. And so these are some examples, but this what I want to focus on and share in this engagement activity. It's also important that we are relevant and that we are, allows for us to be engaged in a vaccination drive or vaccination within the country. I think within the Western Cape, within the areas that responded to this call, and we had supporting the vaccination center on campus, but also in the communities as well. We are in Bellville currently. We have a major role to play in engaging, with the populations and the community in that area. And so it was actually being right there, close to the taxi rank, made it easier for our students to do some vaccination there at the taxi rank. The importance of partnerships, a lot of partnerships, and we definitely partner with communities, but we also partner with other stakeholders. We partner within the faculty, with the health, and the Department of Social Development. Intersectorial approach is definitely engagement activities, with the community being at the center of our partnerships. So what is important is that whatever we're doing, as I mentioned earlier, that we are in the Bellville area, and it's easier for us to engage, I think, being out there. But how do we measure our social impact? We've had open day, I have a faculty, but whatever we do, through our engagement is, and whichever the community is that we're engaging with, it is important that we think about what social impact we're having. Yes. Okay, and thank you, and how we measure this impact. And I actually, it's a little bit more of a challenge, and I alluded to it slightly earlier in my presentation, is that one of the cross-cutting themes of the institution as an anchoring institute, to note that we need to engage, and to say, of the borders of the Faculty of Community and Health Sciences if we want to successful institution. Thank you.